A disease commonly found in adults is rising quickly among Wisconsin kids.
That's right. News 8 Now's Dua Israr explains why the increase in type 2 diabetes in children has health experts concerned. Dua?
Amy and Ken, type 2 diabetes is a form of diabetes where the body does not produce enough insulin to process food into glucose, also known as sugar. In the state of Wisconsin, type 2 diabetes amongst children has increased by 200% in the past 4 years. During the pandemic, students were expected to complete physical education classes on their own time.
Unless they did them live on Zoom together, right? They were supposed to complete them on their own and then turn in their minutes.
Lunch and snacks were no exception during pandemic structured learning.
Without the structure of school and school provided meals at the same times and recess at the same time, and probably way more difficult for many students.
Experts say the pandemic may have contributed to a rise in numbers of kids with diabetes.
We saw an escalation of cases of new onset type 2 diabetes in kids.
Type 2 diabetes occurs when the body becomes resistant to insulin. Symptoms of diabetes include increased thirst, urinating frequently, losing weight, and an increased appetite.
In other words, the body can still make a lot of insulin, but actually needs to make a whole lot of insulin to do the same work than if the person did not have type 2 diabetes.
Although genetics plays a large role in type 2 diabetes, sudden environmental changes may play a part in the increased number of cases.
Change in dietary patterns, also the effect of chronic stress and isolation.
But diabetes can be treated. Nutrition therapy, exercise therapy, insulin, and other medications can help.
It's really a combination of those 4 pillars that we use to treat pediatric type 2 diabetes.
As schools return to in-person learning, access to healthy meals, physical education, and structure can benefit kids.
I think in a lot of aspects, having just PE class back in session and able to participate together.
Setting children up for a healthier future. Common practices like exercise and eating a balanced diet can help prevent type 2 diabetes, but UW Health says a lot of information about the increase in cases remains unknown. Amy and Ken.
Thanks a lot, Dua. And if your child is showing symptoms of type 2 diabetes, UW Health says to contact your healthcare provider.